Hello and welcome to Older Hay. For many of you, it will be your first time here. My name is Adam Dunn and I'm the Clinical Subdean and ENT Consultant. I welcome you all here. I hope you have an excellent educational experience and some fun along the way. The Year 4 lead pictured here is Joyce Lim and she is there predominantly for the PEDS B team. We also have a large group in the medical education team. You will be familiar with some of these faces already. This team is your first port of call, so if you have any problems, please speak to them. You'll see on this slide a mobile number, an extension number, and an email address. Please do use these if you find that something doesn't seem to be right with your timetable. We hope to be able to deliver to you an excellent educational experience. We hope that you will be able to gain everything that you need, everything that is on your curriculum, and everything that will be able to help you get through your exams. What we would like in return is what we call the 3 Ps. They are professionalism, punctuality, and preparation. With respect to professionalism, that means being appropriate for the role or situation that you are in. And essentially, in most circumstances, in a clinical scenario, that means being respectful to staff and patients. People are a little bit like mirrors, really. If you approach them kindly, they are likely to respond kindly. Punctuality. What is the 10-minute rule? Well, we have allocated clinics, theatres, ward work, etc. And in those situations, you will be with a doctor. Doctors, as you can imagine, are busy and emergencies happen, and they may not always be there on time. So we ask you to wait 10 minutes. If the doctor doesn't attend within the 10 minutes, we would ask you to speak to the undergraduate team on the numbers provided on the preceding slide, and they will sort out what's happening, and they'll find out and allocate you where else you can go if that's necessary. We like people to be innovative, but we would prefer it if you did not change your timetable. If you want a change, please discuss it with the undergraduate team. In reality, there are limited numbers that can go to clinic or theatre at any one time, and therefore if you change the timetable, it will disadvantage your colleagues. Preparation. Preparation is everything in life, and in a clinical attachment, that's no different. That means being in the appropriate grey scrubs, having your ID badge visible, and being ready for the activity that you have, either be it in clinic, on the ward, or in theatre. But clearly in theatre, you will have to be in the blue scrubs that you can change into. Again, the ID badge must be visible on the outside of your garments. Attendance. This has changed a little from last year. We still ask for you to sign in. The first day you sign in is a paper sign-in that will have happened this morning, and on all subsequent days it's on the laptop in the reception area of the institute. The sign out, however, is on the QR codes, and there's a QR code dotted around in numerous places. Perhaps the most convenient is in your changing rooms in the institute. There will be a poster up on the wall with a QR code. I'd like to remind you that attendance is meant to be 80%. This is stipulated by the university, and we would like to ask that all timetabled activities are attended. Of course, you can leave if you have other appointments, but we also ask you to respect the rules of the medical school, and if you do need to have some time off, it has to be approved by the medical school. Otherwise, it's considered a non-attendance. There are numerous logos in life, and we have a fair number here. Freedom to speak up, listening into action, raise it, change it. All of these logos ultimately mean we want to hear what you feel or think, and we're happy to change and modify to accommodate people. It's a little bit like incident reporting, but incident reporting tends to be the more serious and more important things. But we'd ask you to speak to your educational supervisor in that situation, or the medical education team if you feel an incident needs to be reported. If you see something wrong, please identify a member of staff and we will fix it. We have a SALS, which is a Staff Advice and Liaison Service, and that's based in the main hospital on the mezzanine level. And the purpose of SALS is that there are psychologists there who are happy to have a conversation with you and discuss any problems that you may have. We're aware that sometimes people feel a bit stressed and a bit unhappy for a variety of reasons, and you can have a confidential chat and sit down with one of those people who are there to help. However, the first port of call probably is with our team. So if you are unhappy about something, please do raise it with us. I think we would like to think rather that you would be happy and content in your work, and we certainly want to create an environment in which you feel safe to speak to us and, importantly, learn in a happy environment. Other things to mention: equality, diversity and inclusion. I'm not going to spend a long time on this. I think for me this all boils down to respecting other people and simply being kind and not judging people. Everyone has their own choices to make. We'd ask you to respect that. Fire, safety and health and safety, trips and slips. Clearly one has to be careful. If there's a slippery when wet yellow sign, please be careful. Be aware if there's some water that's on the ground and there's one of those signs. Fire safety, ultimately if there's an alarm and it's a constant tone, that means that there's a fire in your vicinity, and what you should do in that scenario is follow a staff member out. If it's an intermittent alarm, it means it's nearby but not in your direct zone. Infection control is important. That means that you have to keep your scrubs on whilst you're in the Alder Hey site, and you get changed into them when you come on site and clearly change out of them when you leave. We ask you to wash your garments at 60 degrees because this gives the best opportunity to deal with any infectious organisms that may be on them. When I was a lad at medical school, we only got books out of the library, but at Alder Hey Library you can actually loan laptops. So if you find that your electronic device isn't working, please speak to our librarian and she will be able to sort you out. One of the things I would like to mention on this slide is the phrase up to date. Now, up to date is an online resource that is, as the name suggests, up to date. It has numerous authors who are specialists in their field, and they write about recent advances and current treatments. It's a really useful resource for the majority of what you will encounter. I think lots of consultants use it. It's just something to point out to you if you're interested. So that's it. I hope at this stage you may have some questions, and there will be a member of staff now able to answer them. Thank you for your attention.